City of Hudson to order on February 6, 2025. Roll call.
Alderperson Hall? Alderperson Hall? Alderperson Hall?
Unexcused.
Alderperson Morset?
Here.
Alderperson Wakefield?
Here.
All right, roll call. We did public comments, so anybody in the audience that is here but is not on the agenda, this is where we would take that, and there is nobody here for public comment, so we'll move on to the minutes from our last meeting for approval,
Move to approve.
and I will second. If there's no corrections or discussion, all in favor?
Aye.
Aye. All opposed, motion carries. And number 5A is discussion possible action on approving the Gopher to Badger 5K half marathon. This young lady's here to talk to it, so if you would
Hi, Stacy.
come to, and state your name and your address for the record, please.
My name is Stacy Ink. I live in Baytown Township in Minnesota.
Thank you.
Again, this year, we're planning on producing the Gopher to Badger Half Marathon. We have a half marathon, a 10K, and a 5K. As far as Hudson is concerned, we don't really have any changes. It'll be exactly the same as it has been in years past. One thing that we are hoping to do is add a possible kids run, which I didn't put in our application because we just started discussing that. But the lakefront park where the finish line is an ideal spot for that, and we have a lot of families and kids that come to watch their loved ones and folks cross the finish line, and we have been asked about that, and we thought we would look into it. So we don't have any set plans for that at this point, but it would be a very simple, walk kids, and parents can walk them to one end of the park, and they would run the same pathway to the finish line, and have that crossing the finish line experience. So that would be a fun thing that we would add at some point when towards the end of the race, when the number of runners is starting to wane a little. So, but we're looking forward to a great race. We've had wonderful weather the last couple of years. So,
How many did you have last year?
good question. I should have that on the top of my head. We have 5 different races, so I got to keep them straight. I think we had about 1,500.
Oh, wow. So you anticipate the same?
Yep.
Okay.
Yep.
Chiefs, any problems, issues, concerns?
No, never
No
been an
issues.
issue.
Good.
We've worked it many times, many years, and it's been very successful.
Excellent.
Move to approve.
Second, any further discussion? Seeing none, all in favor?
Aye.
All opposed, motion carries. We'll recommend approval at the next
Great.
council meeting.
Good. Thanks so much.
So you can get to the grocery store now.
Yeah.
5B, discussion possible action on the annual Coco's Heart 5K Doggy Day. Chief.
Sure. Okay, find that one. Anyway, Cocoa Heart event is the same as it has been. The last several years they've been doing this. It's just a good family-friendly event that takes place downtown, and it's a good deal. We've never had any issues.
Okay. You guys have any concerns or issues?
Concerns?
I'll move to approve.
Second.
Any further discussion? Seeing none, all in favor? Aye.
Aye.
All opposed? Thank you, motion passes. 5C, discussion possible action on Hometown Music Fest. This is kind of an annual thing as well.
Yep, set for Labor Day weekend, I think.
Okay.
Always very receptive. The Lions Club's put that on, and it's a good event. Never any issues.
Okay.
They've got their stuff together.
Any issues?
No, not at all.
All righty.
Move to approve.
Second, any further discussion? Seeing none, all in favor?
Aye.
All opposed? Motion carries. 5D, discussion possible action on Valley-wide Pride event. Chief.
Yep, same event. Lakefront Park again this year, weather permitting. It was moved to the high school last year because of weather. basically the same thing, and is the last, this will be the third year that they've done it now, so. We've already been in contact with the organizers to work with them again on security measures and best practices and things like that, so I don't anticipate any issues.
Okay. Any issues?
Nope.
Move to approve.
Second, all in favor? Aye. All opposed? Motion carries. 5E, discussion possible action on the boating ordinance regulation. Yeah, I wonder where this is coming from. Chief, or who's got this one?
That's me.
Okay.
So this is essentially a grant that we applied for with the DNR. By applying for a grant, we were accepted for the grant. What that does essentially is, some of you may remember me asking for a boat in future CIP. One of the things that they do as part of this grant is cover 75% of a new boat and the equipment to go on it. All we have to do is do boating enforcement for 80 hours a season.
Oh,
I think it's a good way for us to have another thing for officers to do that's a little bit different, but also make us more visible out in the river channel and on the islands and things like that during summertime to quell any issues. So in order to do that, obviously, we have to adopt the boating regulations from statute and ordinance, and that's what this is to adopt those boating regulations into our ordinance, our municipal code, so that we can enforce it through the city.
how's this different than from what we've had, or we really haven't?
Well, if we were going to take enforcement action, we'd have to write on the state DNR ticket, and then all money goes to the state.
Oh. And what's the grant amount? Does it vary?
It varies depending on what you're asking for, essentially. And we were asking for a new boat and some equipment to go on that boat,
Sure.
and that's what the cost share is. But it's not set in stone as far as the cost share; it's a percentage. So as long as we fulfill our obligations to them with the grant, then if we applied for the funds, then they would be granted.
And how long or how hard does this tie our hands into the DNR?
I don't think it ties our hands at all. I mean, they hold the purse strings for the grant funds,
And that's about it?
and that's about it.
Any additional training required for,
No, all of our officers go through the, well, if you're born after a certain year, you have to take the boater safety course. So they've done that, and then they train with the DNR wardens on doing boat contacts and things like that. But outside of that, there will be some additional training on the boating regulations with the DNR, so that we actually know what these violations are. Since most of our guys haven't done any of this type of enforcement before, we do have a couple avid boaters that are pretty familiar with the rules. So I'm not anticipating any big expense to the city if that's what we're concerned with. But 80 hours a year, it would require 2 officers to be on the boat per policy. So I mean, we're talking about 160 hours of patrol time on the river
So
to fulfill our requirement.
how does that affect our land schedule and comparatively our coverage? If we have
won't.
2
We're not-
officers out
Yeah,
there?
we're not gonna be taking, it would be either an overtime opportunity, or if we have extra staff on, then those would be the times that
Okay.
2 officers would go out there.
So at this point,
And
it's
I'm
not,
not even
wouldn't affect the
anticipating any
budget
overtime.
at this point?
Correct.
Okay. It is something in the future that we will have to watch, because I think as the community grows, the river grows, I don't want to short the land of coverage, you know what I mean?
Yep.
So, okay.
Yep, we would still staff our minimums for patrol on land, and then whatever is extra would be able to do that, and we can do that pretty easily for, the 160 hours that would be
Okay.
required.
Any questions?
no, but because it's an ordinance, this will still have to
Yep.
suspend it,
Not here.
not here, just when we get to the council.
Yeah,
Okay,
yep.
gotcha. So I guess I move to bring it to,
Well, it'll have to go, is this written? Is this done?
Yep.
Yeah, so it can go right to council then.
okay,
Is
move
that-
to approve to go to council.
Second. Any further discussion? Did you guys have any comments on it or no? Not, you can't use it.
Plan.
You got your own boat.
Yeah.
It's a good plan. Thank you.
I think so, yeah.
This will solidify our spot in the marina, too.
Oh, I know.
All right, all in favor?
Aye.
Aye, all opposed, motion carries, thank you. 5F, discussion possible action on a facility dog. Chief,
Yeah. So the school district approached us as they were applying for a grant to combat drugs in the schools. And part of that grant application had facility dogs or therapy dogs of some sort, that some of their money from that grant could be used to assist with. The school district wasn't interested in a dog. It really wouldn't, I mean, the school officers are so busy that they wouldn't have time to utilize the dog, and the school doesn't want a dog running around the school, right? So they asked us if we'd be interested in something like that, and quite frankly, our peer support team has been pushing me for years on this idea. Most of the wellness training that you go to pushes this kind of an idea. And the reason I'm proposing a facility dog is because it can be used community-wide. It's not just for the fire department, it's not just for the police department, it's not just for the schools, it's for anybody who needs it. So if there's a student in crisis at the school, we can take the dog up there and maybe help diffuse the situation. If we have a mental health call and the person isn't opposed to dogs, we can take the dog to that call and hopefully maybe get that person acting more rational and into a position to better communicate with us or mental health professionals. Our officers or firefighters are on a difficult scene. We can take the dog to the fire department or down back to our police department. The officers can pet the dog, play with the dog, maybe help them realize that they're not going through this stuff alone. There's other things that they can do. You bring the peer support teams in to listen. It's another tool in the wellness tool belt that we have. To me, in my opinion, the price is right, where the first year, the dog is free, generally. Basically what you're talking about is initial setup, equipment for a kennel in the car, harnesses, leashes, toys for the dog, food, grooming, and veterinary bills. First year, that stuff is paid through the grant. Subsequent years, we'd have to absorb that. You're talking food, toys on a minimal basis, right? Grooming and veterinary care, which is generally once a year unless something bad happens. With our canine patrol dog, the apprehension dog, our vet bills average about $1,500 a year. Food is donated, and there's not a lot of grooming with it, right? You get the nails clipped every once in a while. The handler takes care of the brushing and basic grooming. So even the $4,000, I think, is a high estimate, but I wanted to be conservative because I wouldn't want to say, hey, this moving forward is only going to cost $1,000, and then it costs $2,000, and then I'm getting yelled at for saying, why is this costing so much, right? But realistically, $4,000 in our budget is pretty easy to shuffle things around to be able to fund things that we would need to for this.
and how do you screen your current officers for the handler?
Yep, we would have a current officer
6-year
be a
commitment?
handler. Well, the life of the dog.
The life of the dog, okay?
Yep, life of the dog. If something would happen and the dog had to be put down or something after 1 or 2 years, we'd probably give that same handler an opportunity again. But it would be a selection process, be another specialty position, like we have with the school officers, like we have with the rotating detective spot, like we have with the drug detective spot. It gives another
Dimension.
to our department so that people don't have to just work patrol for a 30-year career. You know.
Let's say the budget got tight, what happens? The dog retires with the handler? If we couldn't afford it for whatever reason?
Yep, same thing. Same thing as
Just
what
as
our
canine?
is what our canine would be. The
Okay.
handler would pay the city $1, and then they would take over the liability and the care for the dog.
Okay.
I like the community outreach component of it, that it's, officers need that, but to use it as another tool to help the public as well.
Yeah, it's more of a community dog than it is a police dog, right? Because you start saying police dog, people start thinking a police dog.
Right.
And this is not in any way, shape, or form what that is. It is community outreach. It is helping out in the community and helping our first responders too.
Right.
Absolutely.
Yeah, because it'd be like a little chihuahua, right?
No, generally they're like a lab
Yeah.
or a golden retriever or, you know, a labradoodle or a golden doodle, some sort, you know, if you need a hypoallergenic dog,
Sure.
is generally what it is. But yeah, not an ankle biter.
Everybody's doing it.
They are. It's a growing trend.
Yeah.
Yeah.
Is
And
it work,
wellness
though?
is
I mean-
huge right now, right?
Yeah.
In our line of work. So it's just another thing we can try to do for our staff to give them another thing to help them.
Well, growing up with a father that was a policeman, I'll tell you, he still remembers at 80 years old some incidences, and he'll never forget those incidences. So, if that could have relieved it at the time, who knows?
Yeah.
What do you same thing? You agree?
So absolutely. Dogs are amazing tools when it comes to that. One, for stress relief, you know, after critical incidents, and two, I think, much like Lynn said, a community outreach
Yeah.
dog like that, people gravitate towards dogs, you know, and it's just an
Absolutely.
easy way to start the conversation in public, no matter what.
John, anything to add?
I-
Probably bring it to council, too.
Could. Absolutely. Let it walk around during council meetings.
Well, it sounds like a good thing, and, you know, you gotta always be curious about, you know, careful about the front. You know, it's great, it's free at first, and then what do we occur afterwards? So just as long as we're conscious of it.
I move to approve that we go forward with this.
Okay, and I will second. So this may wanna go to finance or straight to
Well,
council?
I was planning on taking it to finance and then probably
Okay.
moving it to council if it gets through finance, so.
Okay. Any further discussion? Seeing none, all in favor?
Aye.
All opposed? Motion carries. Number 6, any informational items? None tonight, so we'll go right to the EMS update.
My update, I really just gave you some statistics on 2024 volumes. Pretty much very flat. We've always been just seeing a slight increase over here. Business as usual, so you see the numbers there. Response times are good, continue to be good. One of the things I'll point out is our interfacility transfers. You see a reduction in that. That doesn't mean the hospitals have been less busy than they were a year ago. Our hospitals, and when I say our hospitals, Lakeview, Hudson, Westfield, they have been taking on more than they've done in the past, meaning higher acuity patients they've been able to hang on to. That always benefits us, because it's a less time we're sending an ambulance out of the community. And we see the same thing with Lakeview and Westfield, so I just like to point that out, because that is great, that they have that capability to do that. Our mutual aid calls, it looks like the numbers are skewed there, but really what, the change on that is we're getting requested more to do mutual aid from River Falls, Baldwin, Westfields. So if it's a Hudson ambulance that we're sending to do that, that counts in those numbers. And then this past year, Lower St. Croix Valley had a number of issues with their ambulance. They only have one ambulance, so we covered their community quite a bit from here. So that's the reason you see the difference in mutual aid. Our overall mutual aid, I guess on the other side, has continued to go down since 2020. I think it was 2021 we saw our largest amount of mutual aid that we've responded to, and that was like 1,300 and something. And that was when people were having staffing issues across the entire metro. Things are really stabilizing out in that area, so those numbers continue to go down for us, which is good. Our mutual aid request, when we need another ambulance to respond into our community, is probably less than a lot of other services around compared to our overall volume. So we did 33 requests last year for other services to come and assist us. One of the things I guess I should have mentioned on here, when you look at the 2024 and 2023 statistics, just for the city of Hudson, these numbers are, we had 7 mutual aid calls in the city of Hudson last year compared to 14 this year. You know, holy cow, that's doubled the numbers in a year. It's just a blip on the map. There's no reason why that is. It just is what it is.
When you say Hudson Hospital transfers on each of these, is it both the physicians and the hospital? Or,
Say that again?
so you have Hudson Hospital transfers,
Yeah.
but is it also the Hudson physicians when you have calls there transfers or no?
No, that's counted as 911.
Oh, okay.
So we don't, they're technically, it's a clinic. So it's not considered a hospital. So interfacility is hospital to hospital. So anything we do up there, we do a lot of calls up there.
Yeah,
Those are 911.
okay.
So that falls under our 911 numbers.
Another quick question, as long as we're talking about transfer stuff. I'm on the CJCC for the county, and the topic came up about transferring for people under duress, either 72-hour holds or something, mental breakdowns or whatnot, and using ambulance service now, and where that's going to fall into it since we don't have beds on this side of the state. Instead of cramming them in a squad car, we'd have a ambulance with a crew go. That's being talked about at the state level, I believe, county level.
Yeah.
Have you heard?
It's a topic that we have on the Minnesota side as well. So in my opinion, what I've seen in my years in Wisconsin does a little bit better job of handling the mental health calls by law enforcement. Minnesota, it always defaults to EMS. So mental health call almost always is an EMS call and transport. Again, because law enforcement's getting busier, less and less availability on the street. You pull them out of service, they're going to St. Paul to drop the patient off here. They're going to
Winnebago,
3 hours away,
Oshkosh.
whatever it is, so.
Problem is, they're having a mental breakdown. The last thing they want is the anxiety spiking
Right.
because they're in a squad car or
Yeah.
police, they have a problem with police officers.
I know, yeah.
Well, not only that, you have someone suffering from a mental health crisis. Now you got them in handcuffs in a squad car,
Yeah.
like they're a bad person.
Right.
And not only that, then you're transporting them 5 hours across the state away from any support network that they have. So those are the issues. And we're working at that on the association level, at the state level too, is to try and rectify some of these statutes because.
Just to catch you wind of it, I don't know if you knew that it was.
No, I didn't know that. I mean, it's a little bit concerning to me because if there's no medical need for them to go by ambulance and they don't want to go, then basically we're kidnapping the person and you can't do that.
Well,
So, it puts us in a divide between the law enforcement officer, because they're like, we're busy, we need you guys to do it. Our default is, if they can't do it and they don't meet it, we're just gonna do it and deal with it later, but,
because I do know that you guys transferred to Rochester, and I thought that was odd.
transfer to what?
Rochester, Mayo,
We'll do interfacility there.
and that goes charged to the patient or back to you?
No, it gets charged to the patient.
Okay.
Yeah, and we don't do very many of those. And if we do it, we have to have at least 2 ambulances available at the time that we do it.
Before you short the service area?
Yeah.
Okay. Yeah, I mean, and that's a big problem with the transfers to the other side of the state. What do we do?
We do turn down a lot of transfers. We get transfers that, want to go to Eau Claire. We'll do it at at last resort. If it's Hudson Hospital, we'll help Hudson Hospital, but we get Menominee calling and we get Eau Claire calling because nobody will do it. We turn them down because our commitment is to the community and our 911 system.
Right. And
But it's
good
tough.
segue.
Yeah.
My next question, is it up and running?
What,
The computer program?
no, so I do have an update on that. I know Joyce had asked the last meeting if I could give an update. So I did reach out to Terry Anderson at dispatch and said, where are we at with it? I don't want to say they're frustrated, because it's a very complex system. So both Alina and St. Croix County Dispatch have the same systems and they work with the same vendor. And Terry didn't want to say we've discovered a lot of bugs in the system, but even though they're the same systems, one has different components than the other, and they need to talk to each other, and they're having issues with that. So Terry said that both St. Croix County and Alina meet every 2 weeks for 1 to 2 hours with their vendor, and they have been doing that for over a year. And they work through the issues they're having. So they've been running it in the background, testing it and trying to make sure that all the problems are worked out of it. It's not ready to go live yet. He said, I'm reluctant to say it will go live this summer. Their hope is it will. But he said it's kind of unique because there's only 2 other systems in the country that are doing this, and they're beta testing this process. And I think it has to do with state lines. So, for whatever reason, there's some issues with that they're
Well, I
working
hate to be
through.
the guy, but it's time to put a timeline on it. And we've laid out a lot of money for it, and we need to get it for
Yeah,
our residents out.
We have too. We've paid our,
Yeah.
we paid our maintenance fee on it, which is a lot of money, and yet we're not even using it yet, so.
So a
that's an annual
timeframe would
fee.
be good,
Yeah.
or a timeline from them both, or someone.
He did not have one. Like I said, he said, I'm hoping this summer, but he said, I told you last summer, we were hoping last summer would be up and running, so. He assured me they're working as fast as they can on it, and there's no reason for any delays. One of the things right now is Alina's waiting for an upgrade system to their CAD that's not available. And that's kind of stalled things right now where they're at. So he said when that comes in, then they can start testing again, so.
I think we'll need to have a report monthly, or
Okay.
when you're, as
Yeah.
long as you're here, because it's time to
Yeah.
put some pressure out.
Yeah.
I get it,
Yeah.
but it's not fair to who's paid for it.
Right, I agree.
Okay.
Yep.
And just our experience with those systems, it's not necessarily dispatch's fault, it's not
Right.
Lakeview's fault, it's not Alina's fault, it's the mothership,
Yeah.
So, we've got similar issues with them on our RMS side of
Okay.
it, so.
I think we all do, right? I mean, there's things we would like to see changed, but again, it's not St. Croix County's fault.
It's the CAD vendor.
I'm not pointing fingers yet.
Yeah, no,
Well, when you do,
Yeah.
you know where to point them.
yeah. I think that's all I got unless anyone has any questions. Our staffing is good. We're still fully staffed. We have a couple people out on, we have one person out right now on a long FMLA leave. One comes back and one goes on another one. But we have people in the wings that are like, hey, I'll pick up any hours you got. So we're sitting good right now.
That's nice.
Hopefully we can stay there.
Yeah, good. Thank
We're
you.
good right now. So,
Any other questions?
thank you.
Mr. Chief Drew?
Yeah, I don't have the January summary. I didn't have it done in time for the agenda, but did attach the 2024 annual summary or annual report. This will also be part of my report in March for council. It's just the year-end review, call volume, training, stuff like that. New this year, if when you look at it, page 7 and 8, the awards that our members received this year at appreciation dinner. Our people did some pretty amazing stuff this year, and we recognized them for it. And going forward, I think this is going to be a more and more involved process throughout the year. We're establishing an awards committee and a process for nominating people and everything, so we're working through that right now. But it's the first time the department's ever done something like this, recognized individuals for
A little more appreciation instead
more
of the
appreciation
attaboy or
and-
attagirl.
Yeah, and something that's more meaningful.
Yeah.
So at our annual dinner, they received a medal and then a certificate with a
Nice.
summary of the call. And so when you get time, take a look at it. They did some pretty amazing things this year. So, the other big thing to note is the training hours this year. Our membership stepped up big time to continue their education, especially in the driver operator and fire officer side. So we're becoming a very well-rounded department where people can do multiple things, where before they were limited by training, and now we're really becoming well-versed in people being able to do multiple things or different things. So,
Your day responders gotten better yet, or?
no, it's still all over the board. It's depends on the day of the week, what's going on, if it's a holiday. I mean, I can't tell you right now how many people show up for a call in 5 minutes, It's just, it's all over.
Is Mavis working well for you in the surrounding communities?
Yes, for those departments that use the Mavis system, it works fantastic, and we use it exclusively for our mutual aid or for bigger
Yeah.
incidents. Yeah, it's definitely a great system to use.
Good.
Yeah.
Anything else?
That's it.
Question?
I think when you present to the council, this awards page would be a great one to have a handout for the council to see
Okay,
the recognition.
sure.
Excellent. Police Department update.
No real updates. We don't have our annual report yet because we're waiting for the state to finalize their numbers. So we have the January summary that we attached. Any questions about that?
How's your force strength? Are you up to force?
Yeah, we're at full staff on paper. The latest 2 hires that we had to bring us up to full staff are in FTO right now. So I anticipate an accelerated FTO for them just because they're veteran officers from the area.
Oh,
So,
okay.
we should be full staff, boots on the ground here relatively shortly. One of the things that we're working on, obviously the building, you guys have been updated on that. The new building, we're updating policies, going through the policy manual and looking at policies that we don't currently have, ones that we should probably have, making those updates. Those are going through policy review committee, with the end goal of applying for accreditation once we move into the new facility and we actually have a locker room and we have
Sure.
adequate evidence storage and things like that. So that's kind of what we've been working on this month.
Any questions? Melanie, anything?
No.
The traffic committee, traffic safety committee, we need an update next time because there
Yeah,
are
we
some items
met.
that haven't come back.
We met, was it last week?
Yeah, I think it was.
Met last week and there wasn't any new things on there.
No
that we had to talk
recommendations?
about. We are still waiting on recommendations for the parking lot issue.
Okay. So let's put that on the agenda for next month, please.
Yes.
Communications, any items for next meeting?
I don't know if it'll be next agenda, just to make you aware, at some point it's gonna probably come forward. I'm working with Brent right now, putting an RFP together for a staffing study of the fire department.
We knew it was coming, but
We talked the other day, and I think to get a good, well-rounded evaluation of not only the city, but our fire service area, I think a consultant would be what is needed. Then the good thing about that is that cost will be shared amongst the 4 municipalities, so
Okay.
the Hudson won't be on the hook for everything. It's gotten to the point now where I think we need to take a hard look at a 10, 15-year roadmap of where we're gonna be going. So, we're just sitting through that now. I'm just starting to write the RFP right now. Brett and I will be discussing it, and then at some point it'll be coming forward, so.
You know, I'd be curious, is any comparables around the city of Hudson, if you could have them, dig around, whenever you come with that, say, okay, River Falls or Menominee has full-time, River Falls has full-time, still, whoever, if there's some comparables for us to take a look at.
Yep.
And I'm sure the study will do that, but
Right,
if you
but
know.
I can definitely do the comparables of the area at the time.
I'd be
yeah.
curious, just see what's going on out
For sure.
there.
What is the rule of thumb across the river, communities our size? They have volunteer, they full-time, have some full-time?
Most of them have some form of full-time, not completely full-time, but there is some full-time staff, yeah, yep. And the last one to kind of go that route, which I think would be a good comparable for us, is like Elmo. They were almost identical in operating how we are right now, and, was it a year ago, 2 years ago?
2 years ago.
They hired full-time staff, 2 per shift, supplemented by their paid-on-calls.
Okay.
And I've been in contact with Chief Callis over there. I'm gonna go over and sit down with him one day and see how they transitioned.
Great.
But they would probably be the closest comparable to what call volume and what we do in the area that's just transitioned. Menominee's been career for
Yeah.
a long time.
Yeah, I know Stillwater's been
Stillwater's been
career.
career a long time, so. As the metro pushes this way, this is the trend, right? Like, this is nothing new. Your White Bear Lakes, your Lake Johannes, all your they used to be small town suburbs, they're all hiring career staff, full-time staff, because their demand for service just continues to go up and they can't handle it, so.
Yeah, in the last couple of years, Oakdale has gone from the volunteer service with a handful of full-timers to all full-time. Maplewood, same thing, got rid of all their volunteers. And I don't mean get rid of them, but they just hit a point where they're not available anymore.
Sure.
They had to do something. So it's a trend that's been happening for the last 5 years at least.
Well, we've all known it's been coming, so.
Yeah, and the nice thing about this study being done, there should be a cost analysis as part of it, to see, give you different options and what, so it's more than what I can put together.
Sure.
You know what I'm saying?
Yeah,
So-
yep.
so just to be aware of that, it'll be coming at some point here this spring, so.
Great. Anything else before the committee? Seeing none?
Move to adjourn.
Second, we stand adjourned. Thank you.